Good evening. My name's Terry, and I will be the moderator for tonight's call. Thank you for joining our live interactive telephone town hall. We're hosting tonight's event to give Congresswoman Spanberger the opportunity to speak directly with you and to answer your questions about the issues facing Central Virginia families, patients, and healthcare providers. As I mentioned, this event is an interactive forum, and we'd love to hear questions from you. We'll be taking as many questions from Virginians as we possibly can live on this event. If you have a question, you can press *3 on your telephone keypad at any time, and you'll be placed in line to speak with a member of our staff. They will take down your name and where you're calling from. And then the next time you hear your name, you will be live on the call, and you'll be able to ask your question directly. You can also ask a question by submitting one through the portal below our online streaming player at spanberger.house.gov. Again, that's spanberger.house.gov/live. If you're watching on Facebook Live tonight and wish to ask the Congresswoman a question, we encourage you to visit that online streaming portal so you can submit your question. Additionally, if you'd like to receive updates from our office via email, please press *6 on your phone keypad at any time, and an operator will collect your email address. We could receive a lot of questions during this event, so if we're not able to address your question, please call our district office at 804-401-4110 during normal business hours. Again, if you have any questions throughout the event, please press *3 on your keypad or type them below the streaming player. At this point, I'll turn it over to Congresswoman Spanberger for her opening remarks.
Thank you so much, and good evening to everyone who's joining us tonight for this virtual telephone town hall focused on healthcare and the issues facing Central Virginia's families, seniors, and healthcare providers. Tonight, we are thinking of those with friends and family in Louisiana and Texas, and we hope your loved ones in those areas are staying safe and secure. I know this pandemic is personal for everyone. It has impacted people across our district and across our country in many different ways. My office continues to receive hundreds of phone calls and requests for assistance related to healthcare concerns, housing, and unemployment. And please know that you can always be in touch with our office if you need assistance. We know all too well that the COVID-19 crisis continues to create crippling health and economic effects here in Central Virginia. And just this week, I've heard from healthcare providers and public health officials about continued PPE shortages, rising prescription drug costs, and the urgently needed funding for long-term care facilities and community clinics. In this moment, I know that reliable information is very important as we work to keep our families and our neighbors safe. And I'm pleased that tonight we'll be joined by a number of figures who I hope will be informative as we talk through the issues that are on your mind. Among our guests, we have Marvin Figueroa, who's the Deputy Secretary of Health and Human Resources for the Office of Governor Ralph Northam. We have Beth O'Connor, who's the Executive Director for the Virginia Rural Health Association. And we have Christina Barrille, who's the Executive Director of the Virginia Pharmacists Association. Together, I hope we can answer many of your questions about the response here in the Commonwealth, issues related to prescription drug pricing, and the challenges facing our neighbors and friends across the rural communities of Virginia. As we move forward, I remain committed to making sure that we are taking responsible steps to protect our most vulnerable neighbors, to keep our healthcare workers safe, and to allow our small businesses to reopen without putting their workers or their customers at risk. And during such an uncertain time, I remain committed to making sure that millions of Americans with pre-existing conditions remain covered by their health insurance. And I'll keep pushing back against attempts to dismantle our healthcare system or halt the progress that we've made here in Virginia with Medicaid expansion. Thank you again for joining us this evening, and I'll be inviting each of our guests to provide some opening remarks and information. We'll start with Marvin Figueroa. Again, he's the Deputy Secretary of Health and Human Resources in the Governor's Office. Marvin?
Thank you, Representative Spanberger, and good evening, everyone. I have to warn you that I'm a chronic leaner inner. So if I lean in too much, I'll make sure to adjust myself. Want to thank again you, Congresswoman, for the invitation to participate in this town hall. But also want to thank you for your incredible service and engagement. Anytime that we've reached out to you to advocate on behalf of Virginians in Washington, you have answered the call, and I can't tell you how much of a difference that's made in our ability to combat COVID-19. My name is Marvin Figueroa. As mentioned, I'm the Deputy Secretary of Health and Human Resources here in the Commonwealth for Governor Ralph Northam. First, I want to kind of start by kind of talking through where we've been, right? As we approach August, I want to remind Virginians how far we have come. We saw our first case on March 7th. Back then, watching other states, we worried our hospitals would be overwhelmed with COVID patients. We considered building new temporary hospitals. We didn't even know if we had enough ICU beds or ventilators. We knew we needed more PPE and testing supplies. In the 5.5 months since our first case, we've learned a lot about the virus, how it spreads, and how we can keep ourselves safe. So we have expanded the efforts of our local health department with increased resources, support, and supplies to increase the quantity and the capacity of our community testing events. We partnered with our hospital system, Rite Aids, community health centers, and other partners to increase testing. Our community testing locations have been specifically chosen by the local leaders to reach their most vulnerable populations. There have been over 1.5 million tests in Virginia to date, and we average about 13,000 to 16,000 tests per day. The current 7-day positivity rate for our PCR tests or diagnostic tests is about 6.5%. And we know that with successful intervention, timely contact tracing, and testing, a goal of about 5% is attainable. We also had tremendous amount of challenges on PPE, driven in large part because of the global competition for these products, and also the disruption in the supply chain. Just as an update, to date, we've distributed about 1.1 million N95 masks, 8.2 million gloves. We have pending orders about 6.5 million N95 masks, 8 million surgical masks, and 12.7 gloves that we have pending orders. We've been supporting our UVA lab to manufacture, assemble, sterilize, and package test swabs. And we have a decontamination process that allows us to reuse PPE. But we know that the virus is still very much present. And we saw spikes in Tidewater area, for example, which led to the governor issuing EO 68. We've gone through cycles of moderate to low spread, but some regions that have high community transmission. As of today, we have about 116,000 total cases of COVID-19 in Virginia, and even about 1,121 new cases since yesterday. There have been about 9,391 total hospitalizations, and unfortunately, we have lost 2,527 Virginians to COVID to date, and that is part of the 100,000 we've seen nationally. So we continue to focus on our mitigation efforts based on key measures of case counts, hospital capacities, and PPE supply. Governor Northam likes to say that we are facing a health crisis, but also an economic crisis. And until we get past the health crisis, we can't get to addressing the economic crisis. So here in Virginia, we believe in a gradual, science-driven approach to reopening and all the other efforts surrounding COVID-19. Our team has been working closely with public health experts, businesses, industry stakeholders to ensure we move forward in a responsible and measured way. Virginians have been responsible to date. They've done they have been very cooperative and helping us mitigate and contain this virus. And I look forward to the conversation today. Thank you, Congresswoman.
Thank you, Marvin. Thank you so much. And I had the opportunity to visit one of the community run tests with the VDH was putting on in Henrico just 2 days ago. It was a tremendous operation. Next, we'll hear from Beth O'Connor, who is the Executive Director of the Virginia Rural Health Association. Beth.
Thank you, Congresswoman. Appreciate the opportunity to be here with everyone this evening. The Virginia Rural Health Association works to improve health and health care for the 2.5 million people who call rural Virginia their home. Right now with COVID, that's looking at a variety of issues. As Marvin brought up, there's been a huge shortage with PPE It's especially difficult for some of our small rural clinics. They don't have the purchasing power that big hospital systems have, so it's been a little tricky to be able to provide them with everything that they need. Virginia Rural Health Association has been serving as a group purchasing entity to try to buy things in bulk on their behalf and get some decent prices that they would not otherwise be able to get, much less get items at all in some cases. The other big concern we have right now is making sure that people have the opportunity to attend their doctor's visits virtually. This has been going on all over the country, but especially important in rural areas where there's transportation barriers in addition to other issues. And so working with telehealth opportunities and making sure that those are being reimbursed correctly. We're currently very concerned. We've been notified that one of the major insurance carriers has said that starting October 1st, they are no longer going to reimburse for telephone visits. So previously, if you needed to call in and check in with your doctor and see if you really needed to come in person, that's no longer going to be reimbursed by one of the insurance carriers. So we need to make sure that that's addressed. And of course, we're very concerned about the impact of COVID with our minority populations. Very much aware that African Americans are being hit much harder by the virus than the rest of the communities. And so making sure that we address that need urgently. Looking forward, we're very much aware that harvest season is going to be upon us very quickly. And with that harvest season comes migrant workers, people who work the harvest in one community and going on to another. Typically, they don't have medical homes. They have transient housing situations and other situations that are going to make them more vulnerable, both for transmission within their own communities and bringing it potentially from one community to the next as they move with the harvest. So we are looking forward to working with the Congresswoman and other elected officials to address these issues. Thank you.
Thank you so much, Beth, and thank you for your advocacy for rural Virginians. And next we'll hear from Christina Barrille, who's the Executive Director of the Virginia Pharmacists Association. Christina.
Good evening, and thank you, Representative Spanberger, for including pharmacy in this very important discussion. I'm Christina Barrille. I'm the Executive Director for the Virginia Pharmacists Association. We represent pharmacists and pharmacy technicians in the Commonwealth of Virginia who have been working the front lines long before the pandemic, and even more so in the last couple of months. And we've been supporting our members in a number of ways. Obviously, it is most important for patients to continue to have access to those medications that are life-saving and preventative for a number of diseases. And so we have been offering pharmacist relief support when their members become sick with COVID. Additionally, during the beginning of the pandemic, I'm sure you saw many pharmacies taking a number of steps in order to mitigate the risk of spreading the virus. Some of you may have started receiving your prescriptions in the parking lot. Additionally, pharmacists stepped up and started partnering with distilleries to make hand sanitizer that some of you may have purchased from your pharmacy. So pharmacists have always been on the front lines supporting patients. And as Marvin talked about, majority of the testing that's taking place now outside of the community testing sites is happening at most of our chain pharmacies, CVS, Rite Aid, Walmart, and Walgreens. So your pharmacist remains there for you. We support pharmacists in all practice settings. So the pharmacist also working in the hospitals to make sure that remdesivir is on staff and everyone is prepared for when patients come into a hospital and need to be treated for COVID. You might not realize, but medical cannabis is right around the corner, and we do have pharmacists and pharmacy technicians that are prepared to work in the pharmaceutical processors and dispense medical cannabis. So that's going to be coming up in the next couple of months. Additionally, pharmacists remain the number one advocates for patient access to pharmacy services and low-cost prescriptions. And I'm sure if I ask many of you on the line tonight, you will have multiple stories about how you went to your pharmacist and couldn't afford to get a prescription or were being forced to mail order which is something that we're hearing about a lot right now. Pharmacists want to ensure that patients have access to the life-saving prescriptions that they need. And we've been doing this through a number of ways, and that's working with Congresswoman Spanberger on PBM legislation, demanding transparency. And most recently, during the 2020 General Assembly, we started licensing and regulating the pharmacy benefit managers that are the gatekeepers for your prescriptions. And so we are here tonight, and we're happy to be a part of this very important discussion. And pharmacists look forward to continuing to serve you in the community and answer your questions. So thank you. Oh, and lastly, don't forget, we're right around the flu season. So it's important to remember that now's the time to schedule that flu vaccination. So thank you.
Thank you for that reminder, Christina. And again, thank you all for being here tonight. To everyone joining us on the telephone or online, thank you. And I'll turn it back over to the moderator to begin with our questions.
Thank you, Congresswoman. Before we ask our first question, just a reminder that this is an interactive healthcare focused forum, and we'd love to hear your questions. If you have a question, you can press *3 on your keypad at any time to get in the queue to ask a question. A member of Congresswoman Spanberger's staff will collect your questions, and we will answer as many as we can during this live event. You can also ask a question by submitting one through the portal below our online streaming player at spanberger.house.gov. Again, that's spanberger.house.gov/live. If you are watching on Facebook Live tonight and wish to ask the Congresswoman a question, we encourage you to visit that online streaming portal so you can submit your question. And then finally, if you'd like to receive updates from our office via email, please press *6 on your phone keypad at any time, and an operator will collect your email address. All right, so we're going to go to our first live caller. It's Wendy from Chesterfield. Wendy, you're live.
Hi, thank you for this town hall, and thank you for taking my questions. I'm glad you started with pharmacy because, interestingly enough, I received a letter less than 2 weeks before 9/1 that said that my plan, Aetna, was no longer, that Walgreens was no longer going to be covered under my plan, and I can walk to one in 0.2 miles, and they're 24 hours a day, usually, right? And so they're telling me I can no longer use that pharmacy with less than 2 weeks' notice. That's not adequate notification. What I was told by someone at Aetna was that Walgreens canceled their relationship with Aetna, but and I think that has to do with them purchasing CVS is what I was also told, and that's been in the works for years. So less than 2 weeks' notice is not adequate. I do not drive due to disability, so it's very important to me for my children also to be able to have, easy access to our medications. As has been brought up also, the mail, a lot of people are not receiving their medications by mail. I've never been able to get anything approved that would be mailed. So I don't see how that's a viable option, certainly right now. So from a purely health standpoint, those are my points there. But, I have left messages with folks before, and it's health related too, because when you have children on the free lunch program and because you don't drive, you have no access to that, and the school system's not assisting. So we have lack of access to meals, lack of access to technical assistance, and the school system has completely ignored high-risk loss of learning students throughout the pandemic, and there's funds earmarked for that. And I have a son with autism and significant other challenges who goes to a specified autism school, which did open August 3rd. And so even though they're back to school, they're not providing the support they're supposed to. And we've been trying to be teachers for all these years on top of that, so, all these months on top of that. It's very draining. There's just so much going on for people in low income who have disabilities, and it's hard to keep up with anything. And it's just, we're drowning. But from a pharmacy standpoint, that's just like another thing that tops the cake. In addition to that, with financial needs, we're encouraged to go to 211. That number doesn't work. And so I spoke with someone today. In fact, I said 211 has not been working for a week or so. and they gave me 266. That doesn't work either. So when you're in need, it's very, very difficult to basically impossible to get help. That's really everything I have to say for this call. So thank you for the opportunity, and thank you all for listening to my concerns. So I hope somebody has an answer or two somewhere for that. Thank you.
Wendy, thank you so much for being on the line. Thank you for being here. And thank you for speaking on behalf of many families. I know you spoke about your own specific circumstance, but you touched on so many issues that we're hearing about daily in our office. Children and their experiences in school, particularly children with special learning needs. You talked about food insecurity and the challenges for those who rely on food assistance programs in our schools. You talked about challenges with prescription drugs and the delivery via the mail for those who are able to use those programs. So I want to touch on a couple of them, but I also, Wendy, personally for you, would invite you to be in touch with our congressional office, and ideally we can help point you in the right direction for some of the resources related to some issues in your county, and make sure that you're getting everything that you need. I know how hard it is as a parent, and I am just really appreciative that you took the time to share your story. You mentioned the challenge that you're particularly facing given the shift in prescription drugs and the change in terms of where your insurance will allow you to pick up your prescription and the implications that has for you as someone with a disability. So I will invite Christina to speak to that and what they're seeing across the board. But I did want to first mention, as it relates to the needs of our children in food security programs, certainly a focus of mine as a member of Congress serving on the Agriculture Committee, which is the committee of jurisdiction for food security programs, is we have been focused on making sure that even when schools are closed in communities and in states across the country, that those services are still eligible and available for children. And we've worked very closely. I've worked closely with the Department of Education and the Department of Agriculture to ensure that families are able to still get those services for their children. So I'm happy to have our office follow up with you to make sure that there's any additional connections we can make that will do that. But related to the concern of changing your prescription and the parameters of where you can get your prescription, I'll invite Christina to speak to that and perhaps what she's seen in her role with the Pharmacists Association. Christina?
Hi, Wendy. Thanks for your question. I, too, am an Aetna insurer or recipient. So I am currently going through something very similar as well. And I can tell you that insurance companies trying to steer you to use certain pharmacies is not legal. And the good news for you is that Virginia does have any willing provider law that allows you to select the pharmacy that you want to get your prescription from. So there are ways for you to file a complaint with the SEC. Additionally, if you need help kind of navigating the customer service line with your insurer, I am happy to work with you and offer some help there, because I do know that if you know your rights as a patient, when you call and make those phone calls, they go a little bit smoother. So I'm happy to help, but this is something that we are hearing across the board. And unfortunately, this is due to the PBMs, those pharmacy benefit managers that we spoke about before, and the vertical integration that's been going on. And as you mentioned, you have Aetna that now owns CVS, that now is owned by a PBM. So those three players like to keep all the money in line with the same family. But you do have rights as a patient, and you do have choice of where you want to get your prescription filled. And we are happy to work with you and assist with navigating those issues.
Thank you, Christina. And knowing that Wendy's not alone in her experience or her question, Wendy, we will also get some information from Christina and make sure that we're putting out information related to what patients can do and the rights that patients have. We'll put that out on our congressional Facebook and social media as a resource as well in the coming days once we connect with Christina on that. But again, thank you for that question. And as it relates to PBMs, I think I'd be remiss if I didn't mention, as Christina was discussing, the pharmacy benefit managers, which are the middleman organization from the point when you get a prescription written for you to the point where you actually show up to the pharmacy to get your medication. The pharmacy benefit managers, with the vertical integration that we're seeing, they are the middleman organization, and they contribute significantly. At least many believe they contribute significantly to the challenges consumers face in choice issues, but also in the challenges that we're seeing with increasing drug costs. Because there's very little transparency. There's next to no transparency, in fact, in the drug pricing and the rebates that exist. And so I actually introduced a bill that would require that any rebates or vouchers or pricing structures based on incentives would be made public. And that information would be made public so that physicians or patients or researchers would be able to look at it and have a greater understanding of just how much the PBMs do or do not play a role in the continual increase in the cost of prescription drugs. The good news is that bill passed the House of Representatives 403-0. Literally nobody voted against it because it's an issue of transparency. It's an issue of, sunlight does us all a bit of good when we're shedding light on any sort of financial gamesmanship. And so everyone agreed on that point. We're now awaiting a vote in the Senate, and hopefully it will move forward. But I wanted to add that bit in there since Christina had brought up the PBMs.
All right, thank you, Congresswoman. Another quick reminder, if you have a question, you can press *3 on your keypad to get in queue, or type your question in on the streaming platform. Our next question comes from Patty online. Patty says, why does it take so long to receive results from COVID testing? Why does one place take 14 days while another 5 days? This is an embarrassment and just unacceptable for this state and nation. What are we doing to improve this?
Thank you for that question, Patty. I'll begin with giving a bit of a federal perspective and what Congress has done to assist in testing and the pursuit of testing. And then I'll invite Marvin to provide a bit more information as to what we're seeing here in the Commonwealth of Virginia. So first of all, Congress has been very forward-leaning in our efforts to ensure financial support for the production of tests and testing. We've also required in what's called the Paycheck Protection Program and Healthcare Enhancement Act, we put forth a requirement for the administration to develop a national testing strategy. Unfortunately, what we've received back from the administration is a designation that our national testing strategy is primarily to defer to the states to independently conduct their own tests. Congress has appropriated billions of dollars in support of an effort to ensure that across the country, everyone can get a test. And across the country that we can ensure that we can tactically on the ground try and stamp out this virus. Most of what we're seeing in the Commonwealth of Virginia at this point, as in every other state, is the administration has really pushed that responsibility for coordinating testing to the states. And I'm sure Marvin will speak to it, but what we're seeing through Virginia Department of Health and what we're seeing with private providers, depending upon the types of tests that they are utilizing, those do have, and the way that they are batching them, the return times can vary greatly. But Marvin, could you speak a little bit more towards the testing that we have here in the Commonwealth?
I'm happy to, and thank you for that question. So our understanding of the virus is evolving, and so our focus here in the governor's office is to make sure that we have a nimble, sustainable infrastructure to support public health testing priorities, increasing public health laboratory testing resources, and supporting the private sector providers to expand their capacity. So when you mentioned that there are increased turnaround time, it does depend on the laboratory. The testing events hosted by the Department of Health have a lower turnaround time, while the commercial labs that serve a national groups, right, serve different states, you will see an increase testing turnaround time. So that is in large part because there's increased demand in the country that exceed current supply. So when you have outbreaks in places like Arizona or in Florida or in California, and that impacts our kind of private lab capacity and impacts the turnaround time here in the Commonwealth. I will say, just like Congresswoman Spanberger mentioned, in recent conversations with the CDC, for example, where we had a dialogue about the challenges that we're facing around testing supplies, and checking in to see what kind of support we can get from the CDC. The biggest takeaway was that the expectation is that we are on our own. And so right now, the current conversations about improving our capacity are around three things. One is potential mechanism within the Commonwealth to share resources amongst our hospitals, to band together in terms of acquisitions. As you probably noticed or read in the news, the governor joined a compact with 10 other states to figure out how we can work together amongst the states to be able to do procurement together. And then we're also exploring ways for Virginia to kind of do their own supplies. So those are kind of the three things that we're doing to, again, kind of push ourselves to think creatively on how we increase capacity. We also have a partnership with the hospital systems so that we can band together. It's going to be called One Lab. So we can coordinate on everything from transporting the media to reagents and other areas where we have experienced shortages. So again, we can collaborate because more and more is becoming clear that it's up to the states to try to do a lot of these things on their own, even with support of congressional members like Congresswoman Spanberger.
Thank you so much, Marvin. Okay. Passing it back to the moderator. Thank you.
Thank you, Marvin. Appreciate that. Our next caller is Mark from Midlothian. Mark, you're on live.
Okay, thank you very much, and thank you for having this virtual meeting. My question involves the mail service, and I have a lot of difficulty understanding why DeJoy would dismantle 700 sorting machines, although the USPS, from what I gather, already own these machines, as well as quite a number of mailboxes that are being on trucks right now instead of being on the highway. As a former postal service worker, I was interested in your reaction to this movement with the USPS. I'm concerned that our president has stated that the Democrats would have an advantage if mail-in voting became universal throughout the country. And how can dismantling 700 sorting machines be a savings of money? That just can't wrap my mind around it. I'm a volunteer on the phone bank, and I've heard from a number of people that they're going to vote at the polling station, although these folks are elderly, as I see their name and age on the screen as I call them, and they're reluctant and a little frightened, but in order to get their vote counted, they're willing to go to the post office, to the polling place, rather than put the ballot in by mail. The last piece is people are looking for their prescriptions to come to them on time, and having a week or 2 weeks delay can be very serious. That's my question. Thanks so much.
Absolutely, Mark, and thank you. The issue of delays of the Postal Service and of mail delivery have been significant. We, in our office, in the period of 1 week, received more than 1,200 calls and emails last weekend related to the Postal Service. There had been calls and emails before that, kind of starting as some of the concerns were initially in the news over the weekend. It was more than 1,200, and then it's continued from there. This is an issue at the top of mind for people across our district, and a major concern relates to prescription drug delivery. Many people rely on the delivery of their prescription drugs, particularly our nation's veterans, and particularly our neighbors in rural communities. So I'm going to invite Beth to speak in a moment to what she's heard and what the impact of these continued slow stoppages, well, not stoppages, but delays in delivery would mean for some of our neighbors in rural communities. But importantly, the action that we've taken is currently Postmaster DeJoy has said that he will stop taking future action. Mark, I can't necessarily assert or justify how taking sorting machines offline creates efficiency, but that had been the assertion that the new postmaster had made. Unfortunately, taking sorting machines offline, putting out a directive not allowing for overtime, ensuring that that delivery trucks were going out as once, at the time they needed to go out, even if they were not completely full, created significant delays. And we've been hearing reports across our district of delays of mail, of paychecks, and certainly of prescription drug medications. He said that he will stop this. We continue to advocate and push for the postmaster to ensure that every machine is put back in place. Over the weekend, we did in the House of Representatives pass a bill with bipartisan support that would require that any changes that have been made since in recent weeks be reversed, and that no changes to postal function where it was January 1st of 2020, that no changes can be made until 2021 or when we are officially out of the pandemic. So recognizing that the time that people are relying on the mail delivery for the purchase of items that they're too afraid to go to the store and buy, and particularly for their prescription drugs, that this is not the time to change our postal operations. We did pass that bill. It received bipartisan support. We do not expect it will receive a vote in the Senate. But I think it has demonstrated very clearly how the majority of the House, again, folks on both sides of the aisle, this isn't a partisan issue, in the House of Representatives feel about the necessity of timely delivery of our mail. And Beth, would you have any comments related to what you're seeing?
Sure. And mail delivery, especially in rural communities, is so essential. Your rural communities more likely to be elderly and more likely to not have internet access. So the delivery of the U.S. mail is absolutely essential, whether it's getting medications, whether it's using it to pay your bills. Many of us pay our bills online and don't think anything of it. But for a lot of folks, if you don't have a broadband connection, that's just not feasible to be able to do your banking online. So having our mail, for those types of services, and especially coming up to be able to vote, is something that we've got to be able to secure. Absolutely. Thank you.
Yeah, and I would just like to add one thing, if I could. I encourage you, if you're being forced to use mail order and you have concerns, to reach out to your healthcare provider, because as I mentioned before, we do have an any willing provider law here in Virginia. I know that mail order might work for some people who have transportation challenges or find it very convenient, but it's important to note that Virginia does not regulate mail order temperature. So if you are receiving a mail order medication, it's not being kept at a certain temperature majority of the time if it's outside of a specialty medication. So delays in medication getting to you, especially today, I believe it was about 100 degrees here in Richmond. So just take that into consideration. And as always, please reach out to your community pharmacist, and they will be happy to ensure that you get your medication in a timely manner, because obviously the delays that are happening right now and at the beginning of the pandemic, it was expected that mail order medications could take a hit just based on the postal service being susceptible to COVID as well. So just reach out to your healthcare provider and ask them if you're able to transfer your prescription for the time being.
Okay, thank you, Christina. Our next question comes from Bruce, who's a physician. It's an online question. Where do we stand on the use of copay accumulators for chronic medications on ERISA-based insurance plans? That one might require a little explanation.
Thank you so much, Bruce, for that one. And Bruce left that one online. Is that the case?
That's correct.
So Bruce, that is a bit of a deeper dive question, and I will have to follow up with you to give you the most up-to-date information on that.
Okay. We will go to another online question. This one is from Lou. What things can you put in place for senior citizens with limited income who need care and costs are too high?
So related to healthcare overall, this is one of the greatest challenges that we face as a nation is the continued increased costs in prescription drug prices and increased costs in healthcare. Among the things that have been a priority for me in our work to lower the cost of healthcare writ large is to allow Medicare Part D the ability to negotiate its prescription drug prices. And this is an important issue, whether you are on Medicare or not. The fact of the matter is that the VA has the ability to negotiate its prescription drug prices to benefit the VA system and the patients in that system, whereas Medicare does not have the ability to negotiate prescription drugs. And so when we look at the millions of Americans who are on Medicare, the weight of those numbers and the bargaining power of those numbers is not something that those patients are able to actually take advantage of. And this requires a change in the law. This requires Congress to take action. And we have in the House, we passed a bipartisan bill, H.R. 3, the lower, aptly named, the Lower Prescription Drug Costs Now Act. It did receive bipartisan support in its passage in the House. And the primary focus of this bill is to allow for Medicare the ability to negotiate its prescription drugs, which I mentioned the bill passed with bipartisan support. And notably, during the run-up to the 2016 elections, this is something that the president spoke about frequently, an interest in giving Medicare the ability to negotiate prescription drugs. So this is one element of that bill. Another element of the bill is that the negotiated price benefit would be available to all commercial insurers. So it isn't just about ensuring that those who receive their prescription drugs and their health insurance through Medicare have the benefit of those negotiated rates. The benefit of those negotiated rates and the power of that size of a membership or coverage pool would be extended to commercial insurers and those who are insured by commercial insurers. This is incredibly important in creating that market competition that will put downward pressure on prices. It is just astounding that Medicare is not allowed to actually make use of the competition in the marketplace to deliver better prices to its recipients. So that's one element of that bill. There's also been, as it relates to prescription drug pricing, I have supported efforts, the CREATES Act, which would ensure that generic medications could get to market in a way that is timely and efficient. So frequently we will see that some pharmaceutical companies do endeavor to engage in what's called patent thicketing, so layering patents on top of each other to really delay the time that generic medications can be available to patients. That bill did pass the House also with bipartisan support. And then I introduced a bill that's currently in committee that's focused on biosimilars, so the generic version of biologic medication. And that bill, it is bipartisan in introduction. We have a companion on the Senate side, and it will essentially ensure also that with biologic medications or biosimilars, that those medications can get to market as efficiently and as safely as possible to the benefit of those who require those often costly medications. So that's specific to the prescription drug element of it. But truly, when we're looking at premiums and the cost of our prescription, of our healthcare, so much of the cost is related to prescription drugs and the cost that they have in the larger scheme. And another priority of mine is the implementation of a public option. So as of right now, across Virginia, we have counties where there's only one exchange option under the ACA. And that doesn't allow for that competition. That doesn't allow for downward pressure on pricing. And I support a bill that's called the Medicare X Choice Act. I'm a co-sponsor of that. And it is a bill that is focused on creating a public option plan on the Medicare network. So those who choose to buy into this program will have an additional option. And the benefit here is that the Medicare network is already available in every zip code across the Commonwealth and the country. And to be able to use and leverage what are already the negotiated rates under Medicare would provide greater options for patients and greater options for coverage. And that benefit isn't just for the person who chooses to go that avenue or that route for their insurance coverage. It benefits everyone because, of course, the larger pool, when there's a larger pool of individuals without health insurance, that is part of what is driving up the risk for those who have health insurance, for the insurers in the area. That's what's driving up the costs in hospitals. And so ensuring that our neighbors have access to affordable quality healthcare impacts all of us and our larger economy. And those are the things that I've been focused on, lowering the cost of prescription drugs specifically, and then also ensuring that there are more options for health insurance coverage so that we can have more Americans insured and able to get the preventative health care that they need to also keep costs down. Notably, I am also focused on protecting our current healthcare system and the essential benefits that come with the ACA, such as ensuring that young people up to 26 can stay on their parents' insurance. That is an element of the ACA. And also protecting the Medicaid expansion program, which in the 7th District of Virginia, about 50,000 of the people that I represent are insured through that program, which is particularly important during a global pandemic. There are current efforts that the administration is taking on to challenge the ACA in its entirety in court. And I am leading a resolution to ensure the protection of the ACA and the security that it brings to so many of our neighbors and the security that it brings to our larger economy when we have access to affordable quality health care. So thank you for that question. Would any of the other panelists care to comment? I went a little bit lengthy on that one, but anyone else care to comment?
I can talk to a little bit about that. One of the things that I would definitely recommend is to make sure that the insurance carriers have to reimbursed for a wide variety of options. I mentioned a little bit in the opening remarks that we're looking at, I'll name them. Anthem is saying that as of October 1st, they will no longer reimburse for phone visits, which means either the patient has to pay for that phone visit out of pocket or the clinic has to absorb that cost. And we've got a community health center who thinks they're going to lose $250,000 a year because Anthem won't pay for phone visits. And that's not fair to the community health center. That's not fair to the patient. That only benefits Anthem. So requiring those insurance companies to reimburse for what they're supposed to be doing is essential.
Thank you, Beth. At this time, a quick reminder that if you'd like to receive updates from our office via email, please press *6 on your phone keypad at any time, and an operator will collect your email address. Our next question comes from an online listener, Robert. It's related to the last question. Could Medicaid waivers be expanded to compensate providers for telehealth, phone primarily, particularly in a rural setting, to reduce travel requirements for patients, which is often problematic due to limitations for low-income individuals?
Thank you very much for that question. I'll speak first and then open it up to any of our other panelists who want to add. So telehealth has been a tremendous option for so many people across Virginia and the country, particularly in the context of a pandemic, as doctors' offices have closed initially, as patients, particularly those with underlying or pre-existing conditions, were concerned for the risk that it would take to go to the doctor's office. And so within the legislation that Congress passed that was signed into law, we created a $200 million program that is ensuring greater telehealth access. It was so popular that we very quickly provided out all that grant money. It was applied for and accepted. And in fact, some providers here in Central Virginia that attempted to be a part of that program were unable to join. So I have been a co-sponsor. I led a bill with a colleague from the Midwest, a Republican from the Midwest. We led an effort, and we are still working on it, trying to continue garnering support to extend that program, because the benefits that we have seen in Central Virginia, in my case, in South Dakota in his case, and from our colleagues across the country for the expanded access to telehealth has been vital, particularly for our seniors, particularly for veterans, and particularly for smaller community health providers. And so that's been a focus of mine. It's incredibly important. Of course, it does then bring up the issue related to broadband internet accessibility, because while telehealth is a tremendous option for so many, if you are unable to utilize it, then due to lack of internet at your home, then we do see significant challenges. And that gets to the point that Beth mentioned earlier, with the notice that many providers, or that there will be refusals to pay for telephone calls in the future for the telephone services as opposed to the video conferencing style. So would anyone add anything else to that, to answer that question?
So my short answer to the question would be yes, we absolutely can do that and absolutely should do that. But again, as you mentioned, broadband is a major concern. I think there are a lot of people in Virginia who don't realize how limited broadband is in some areas. Once you get outside of town limits, and sometimes even in town limits, there's very little, if anything, available. I like to hold up my own house as a very horrible example. I live 7 miles from Virginia Tech, and I have nothing at my house. And I'm sure I am not the only one, and we absolutely need more infrastructure for that essential service.
And I just wanted to add, I don't want to step on Marvin's toes, but I know that the administration has directed some CARES Act funding for the managed care organizations to reimburse for telehealth. So I do believe that Medicaid has already stepped up and is reimbursing for this. So if you have any issues on that, I would recommend that you reach out to your provider because I believe those services are available.
And for clarification, Christina was mentioning the Northam administration, so at the state level, with the CARES Act funding coming from Congress into the Commonwealth. And I would like to mention Bruce's question that came in earlier related to the ERISA plans. So one of my team members will be following up with you directly, Bruce, but I did want to let you know that I did co-sponsor legislation banning copay accumulators in the individual marketplace, but we're going to gain some clarity on how that may in the future impact ERISA plans, if at all. So we'll follow up with you directly on that.
Okay, our next question comes from an online listener, Ranjod. It's common to find discounted drug prices with huge copays when you do a web search. Pharmacies usually will not alert patients, and insurance carriers have a vested interest not to advertise. How do you make it equitable?
So I'm going to offer this question straight to Christina because I've heard her speak to this issue before. Go ahead, Christina.
Well, I think what Representative Spanberger has been doing at the federal level to, implement transparency and what the Virginia Pharmacists Association has been doing at the state level to ensure that the pharmacy benefit managers are licensed and regulated here in the state is going to help. And I will say that up until about 2 years ago, your pharmacist was not allowed to tell you if you could save money by not using your insurance. So if it was cheaper for you to pay cash, And I just also wanted to mention, I know I get a lot of calls about this, about all the discount cards that are out there right now with GoodRx and some of those programs. I was on a national call yesterday, and it was explained to us that the reason that those, and I'm not saying that this is all the programs, I'm just putting this out there, that most of those programs exist because what you do when you decide to take advantage of one of those discount programs, you're actually giving them access to your personal information, in which case using that discount now gives them the right to provide and sell your information to third-party vendors. So say you're a person who might be going to get your diabetic medication filled, and then in 2 weeks, you just so happen to get an offer for diabetic shoes in the mail. And in your mind, you're just thinking that this is random spam. But what's actually happening there is the industry wants to be able to control every level of your care. So I just put that caution out there that if you ever have concerns about the cost of your prescription, the absolute best person for you to speak with is your pharmacist. They know the plans, they know the PBMs, they know all the players, and they will do what they can to ensure that your medication is available at the lowest cost. And that includes therapeutic changes as well. So say, as Representative Spanberger spoke about before, you might be on a brand medication and there may be a generic equivalent that's available, and it might just involve calling a physician and getting that switched over. So always have those conversations with your pharmacist.
Okay, thank you, Christina. Our next question is from George. George, you're live. Hello? Hello, hello? Well, I think we lost George. I will go to an online question from Ken. What is Congress doing to investigate administration pressure on the CDC and the FDA?
So I'll take this one. Thank you for that online question. So there's been significant challenges in the areas of oversight, and the Oversight Committee within Congress has been active in ensuring that we, as members of Congress, and are fulfilling our constitutional duty to ensure the good, positive, efficient function of our country's agencies. Some of the challenges that we have seen in particular have been the movement of and changes in reporting requirements, changes of how information related to COVID infection rates and testing rates, and geographic and demographic information, changing how that information would be reported to the federal government. We've now seen 2 such changes, which, having heard from scientists and researchers, this is incredibly harmful in potentially allowing for our longer term ability to study the spread of this virus and address its impact. It also has significant impact on providers and physicians, changing the mechanism and the structure of how it is that they are reporting information and the infections and tests they've administered has created real challenges. So we have, within the House of Representatives, filed legislation and resolutions addressing some of the adjustments, particularly the area of reporting information has been the one that's most concerning to me. But it is incredibly important that the American people have the faith in our country's agencies, particularly CDC, particularly NIH, as we are moving very quickly within this pandemic, as our nation is working towards the development of a vaccine, as we have invested billions of U.S. taxpayer dollars in trying to get to a vaccination and a vaccine protocol quickly, as well as a treatment. And we need the American people to know that the agencies that have been long entrusted with a focus on science and public health are continuing to function with a focus on science and public health. There's been the polarization and politicization around COVID-19 in a way that at times has been very, very detrimental, I think, to our nation's ability to respond to the pandemic. But back to the heart of the question, what Congress can do, continue to do our constitutional duty of oversight. And while I do not serve on the Oversight Committee, I serve on Foreign Affairs and the Agriculture Committees. My colleagues on the Oversight Committee have been very active in bringing forth, particularly CDC leadership, to testify before Congress about the work that the CDC continues to do and the research and the ever-changing environment related to COVID.
Thank you, Congresswoman. At this time, we're coming to the end of our live event this evening. Congresswoman, would you like to make some closing remarks?
Thank you. I would love to just say words of appreciation to everyone who took the time to join us this evening. To our guests, Marvin, Beth, Christina, thank you for spending time helping answer the questions that are on the minds of people across Central Virginia's 7th District. I appreciate all of your work and your advocacy, Beth and Christina, on behalf of folks in rural Virginia, in your case, Beth, and on behalf of anyone who needs a prescription medication, in your case, Christina. And special thanks to Marvin for all of your work in the as Deputy Secretary for Health and Human Resources, which is really I know you're doing so much in leading the way with the department as we continue to ensure that Virginians across the Commonwealth are getting tested, and that we as a state are taking control as much as possible during this time of a pandemic. I'm grateful for those who asked questions today. Thank you for the opportunity to speak directly with you. And we will be providing some additional details on our social media, Facebook pages, and pushing that information out, particularly related to some of the questions in the area of prescription drug medication. I hope you all are staying safe. I thank you for your time. And as always, if we can do anything to help, please be in touch with our office. We are here to help constituents, and we welcome you. I welcome you to give us a call. Thank you very much for spending this time with us.
If we were not able to get your question this evening, call the district office at 804-401-4110 during normal business hours, or go to spanberger.house.gov. Thank you again. Stay healthy and safe, and have a good evening.